Hello, I'm Dr. Mark Stovak, Medical Director for Via Christi Sports Medicine. This is Amy Cahill, our athletic trainer extraordinaire with sports medicine and head athletic trainer at Independent High School. We're going to do a physical exam video for you today to give an example of a basic joint exam for all of the joints, starting with the ankle. So the first thing that we start with when we're examining a joint is inspection. And when you look at Amy's foot and ankle here, the first thing that you want to look for is swelling. Go ahead and raise your ankle up. And right here in this somewhat dead space, and then if we rotate our ankle out, and in this dead space, you'll see that there's somewhat of a hole, and that's a normal joint. If it's swollen, it will swell in this area here and in this area here. You look for bruising, other areas of trauma, and then from there go on to palpation and try to find the areas that hurt. Usually you pick the areas that hurt the most last. So first, to start with identifying landmarks, on the medial side you have a wide deltoid ligament and the medial malleolus of the distal tibia. You have the posterior tibialis tendon, which comes down and inserts on the medial navicular. If you follow that across, you can find the end spot where you get a navicular stress fracture, and it's easy to identify that because you have them raise their big toe, and you identify the extensor hallucis, and then you have them raise their ankle to identify the anterior tibialis, and the spot right between the two is the end spot. Next, you can find the dorsalis pedis pulse just next to the extensor hallucis, this line here. You can find the joint line just by palpating across the soft spots here of the joint. And then the lateral structures, you can identify the base of the fifth metatarsal, which is often fractured in ankle sprain. But just behind that is the cuboid. Just behind that, the soft spot is the sinus tarsi. And then your ligaments, which often are injured in ankle sprains, the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. And then you identify the peroneal tendons coming down and inserting on the base of the fifth metatarsal. The other structure which is injured in a high ankle sprain is the anterior tibial fibular ligament, which is just above the joint here. So once you've palpated the important anatomy to figure out exactly where they're sore, then the next thing that you want to do is have them do range of motion. Usually when they have injured their ankle, they'll come in with their foot in plantar flexion because it's swollen and there's more room in the joint in that position. So the first thing that you have them do to work on motion is you have them plantar flex to identify how far they can go down, always comparing it to the opposite good ankle. Hopefully there's a good ankle. Then you have them dorsiflex to see if they can get as much dorsiflexion as possible. Then you have them evert the ankle, and then you have them invert the ankle, comparing range of motion. Then beyond that, you can have them raise their toes. Usually the toes don't move very much, but you can always see that the great toe, and it should raise about 70 degrees of motion. If it doesn't, it's called hallux limitus. Then you have them flex the toes. Next, you can do all of those against resistance, where you have them, you resist against their dorsiflexion, you resist against plantar flexion, and so on and so forth to test muscle strength and to see if they have pain with firing those tendons. So after looking for swelling, doing inspection, palpation, and testing for tendon strength, you can start testing for ligamentous laxity. The first test is the anterior drawer, which tests the anterior talofibular ligament. The easiest way to do the anterior drawer test is to put your top hand on the tibia and fibula and to cup the calcaneus with your bottom hand. Push back with the top hand and pull with the bottom hand in order to apply some traction to that ligament. And you want to do this as hard as the patient will allow you to do it. The next test is the talar tilt or the inversion stress test. And on that test, you're testing the calcaneofibular ligament. And the best way to do that is to do a very similar exam. However, instead of pulling forward with the bottom hand, you twist the ankle into inversion. And you just test for laxity. You want to do this again as hard as the patient will allow you to do it. Those are the ankle ligaments that are injured in an ankle sprain. The posterior tibialis is the third ligament, which is there's not a good test for that ligament. The next test is to test the anterior tibiofibular ligament, which is what is injured in a high ankle sprain. One way to do that is to do a squeeze test, where you just squeeze the tibia and the fibula together. And you want to note how far up the syndesmosis, the area between the tibia and the fibula, they develop pain. Another way to do that test is to forcefully dorsiflex the foot and then externally rotate the foot or the ankle, and that will stress the tib-fib ligament. And that is what is injured in a high ankle sprain. Once we've done the ligamentous exam for stability, the last thing that I test for is palpation of the Achilles and the retrocalcaneal bursa, which sits just anterior to the Achilles tendon. Another way to test to see if they're having bursal pain is to forcibly plantar flex the ankle and pinch that structure, which sits right back in this soft space anterior to the Achilles tendon. That concludes our foot and ankle exam. The next thing that you can have them do is stand to look at their arches and walk to evaluate their gait. But as far as the joint exam, which we wanted to point out, that would be a basic joint exam.